Assalamualaikum warahmatullahi wabarakatuh. I would like to thank the chairperson for a nice introduction. My name is Barakatun Mohd Yusof. I'm a professor in nutrition and dietetic from University Putra Malaysia. I would like to share on the topic of Ramadan nutrition plan for diabetes. This is the disclosure of interest, ladies and gentlemen. In this presentation, I will cover in terms of the usual nutrition guide for people with diabetes, whether or not they have any different with Ramadan nutrition plan. Then we will indulge more on the Ramadan nutrition plan and to identify what are the benefits and the key takeaway. And all of this are based on the chapter 8 of the Ramadan nutrition plan that we have developed together with Professor Osama Hamdi and my good colleagues Salma Mehar, who has just presented about the available online platform for the RNP. Ladies and gentlemen, we know that the role of medical nutrition therapy is critical in diabetes, no matter what type of the patient is at for diabetes. And this is even more critical during Ramadan. This is because Ramadan nutrition practice among patients with diabetes are not optimal. In our study, we found that there are still patients who skip sahur. They increase the consumption of sweetened food and beverages. They became more sedentary during Ramadan. And what concerned me more is that 70% of the patients did not receive specific Ramadan nutrition education. This is consistent with a new review that found many patients admit that they do it yourself approach to diabetes management during Ramadan. Now, is there any difference in nutrition plan on usual day versus during Ramadan? So, in managing diabetes, healthy dietary pattern remains, and key fundamental strategies is to manage carbohydrate wisely, because dietary carbohydrate, especially from the refined carbohydrate, will give a highest impact to the blood glucose. We recommend people with type 2 diabetes to consume carbohydrate from the low GI properties, which mainly come from the whole grain. A good combination from dietary fat as well as dietary protein will stabilize the blood glucose level. When it comes into managing carbohydrate, we recommend education strategies surrounding the concept of 3T, which mean prescribing appropriate total amount of carbohydrate, choosing the right type of carbohydrate, and distribute carbohydrate evenly throughout the day. And these recommendations are similar during Ramadan. This slide shows how we distribute the carbohydrate and certain education that can be provided to the patient with regard to managing carbohydrate. Now, let's look at further on the Ramadan nutrition plan. So the Ramadan nutrition plan is governed by the principle of medical nutrition therapy. It includes 5 main components that, first of all, providing pre-Ramadan nutrition education. We assess their risk and understanding about nutrition-related issues. We set the appropriate amount of calories, either for weight maintenance or reduction. And the whole process are guided by the 10 Ramadan nutrition principle. And at the end of the session, patient should be received country-specific meal plan. These are the 10 Ramadan nutrition plan principles. And in this presentation, I will highlight the key 5 main components that we found would truly help patients in achieving the benefit of Ramadan fasting. The key number 1 is healthy dietary pattern remains during Ramadan, and that includes choosing the right type of carbohydrate, come from whole grain, fruits, vegetable, and others. Choosing a lean protein, especially from the plant-based protein, and minimize the fat. Fat should come from a healthy one that include nuts and seeds. This is critical because in this review, for example, they found that the dietary composition during Ramadan showed increase in consumption of all components of the diet and mainly come from low dietary quality. This is especially critical because the adherence during Ramadan to a healthier diet seems to be difficult. And therefore, they recommend repeated counseling and education. And this is highlighting the importance of having pre-Ramadan nutrition education. Second, patients should be informed to achieve optimal carbohydrate within the appropriate energy intake, as explained or as they have practiced during the non-Ramadan period. This is critical because in this article, for example, they found that the food consumed during Ramadan tend to be higher in carb. As you can see in this graph, the amount of glucose is increased significantly, especially between during iftar. Yeah, and that mainly contribute by the amount of carbohydrate, as you can see in this graph and in this figure. Yeah, all right. So therefore, providing optimal amount of carb distribute evenly between sahur, iftar, and healthy snack within the appropriate energy intake is critical. Key strategies number 3 is to optimize sahur and having a mindful iftar. The Ramadan nutrition plate can be used to support this recommendation, especially to recommend sufficient amount of protein and fat during sahur. This is critical, especially among Asian patients with type 2, because during sahur, their food intake is mainly revolved around carbohydrate. And carbohydrate food alone, no matter whether they are refined carbohydrate or carbohydrate with fiber, may raise blood glucose level more quickly than the mixed carbohydrate, the mixed meal that contain fat, protein, and fiber. This is important because we do not want the blood glucose increase significantly after sahur and then drop drastically that put them at higher risk of hypo at midday. This is some modification that we can suggest to our patient that include the component of protein, fiber, and appropriate amount of fat rather than just focusing on carbohydrate. These are the 2 studies that we have published with regard to modifying the carbohydrate by adding appropriate amount of protein and fat. And in our patient, for example, we do introduce diabetes specific formula due to the difficulty in identifying appropriate food. And this provides clear benefit to them in terms of clinical outcome as well as dietary intake. Date consumption is also controversial, but we know this is sunnah during Ramadan. And when we recommend dates, we have to control the amount, and that should also be counted as part of carbohydrate recommendation. Dates is basically low in GI, and therefore 1 to 3 can be eaten safely when breaking fast. Key recommendation number 4 are given to the fluid intake. We recommend patients to drink fluid sufficiently, and it must be distributed evenly throughout iftar and sahur. Recommendation on fluid must be also include education about minimizing caffeine, sweetened beverages, and salt intake. Key recommendation number 5 is refrain from overindulge, because we know during Ramadan, we do have bazaar, we do have buffet Ramadan, and therefore we recommend patients to plan their meal ahead of time, aim for healthier choices, cautious with the amount of carb, especially from beverages, and sharing a meal with others. Physical activity is also important and should be maintained during Ramadan, and Tarawih prayer is considered as part of physical activity. And be cautious among those patients who wanted to do physical activity excessively, but because this will put them at higher risk of hypo. The benefit of structured education are clear, including nutrition. It will provide favorable clinical outcome and prevent patients from complications that have been discussed extensively during this conference. We also found that by giving Ramadan nutrition plan, the amount of carbohydrate can be controlled and within the recommendation, as opposed to the usual care where we found that the iftar and pre-bed snack has excessive amount of carb than the recommended amount. And this has been translated to the improved self-monitoring blood glucose for those in RMP at pre-sahur and pre-bed as compared to the usual care. We also found that their continuous glucose monitoring is improved or is better during Ramadan as compared to non-Ramadan, as well as in comparison to the usual care. What are the key takeaways? Number one, there is no difference in nutrition recommendation between Ramadan and the non-Ramadan period. But Ramadan is unique. They poses a higher risk of complication, and without a proper pre-Ramadan nutrition education, patient may not be able to fast safely. When patients are given pre-Ramadan education, it must include the RNP. And with 5 key focus that include retain overall healthy dietary pattern, manage carbohydrate within the appropriate energy intake. The education should optimize sahur and mindful iftar, and this can be achieved by using the Ramadan nutrition plate. Good hydration status, last but not least, refrain from overindulge. The principle of RNP should be continued during non-fasting period. Studies have shown that those patients who following the RNP, they have better A1C versus control until the next Ramadan. We also encourage all dietitian and nutritionists and any diabetes educator who are interested in Ramadan nutrition plan to work with us in contributing menus so that we can enrich our database. With that, thank you very much.